Hey team, welcome to the ANS or Autonomic Nervous System module for Pharmacology. In this module, we're going to be spending a little bit more time, or probably a lot more time, studying and memorizing some concepts than we did in the Intro to Pharmacology section. The autonomic nervous system is an essential nervous system for emergency medicine, and really all levels of emergency medicine. In fact, at the EMT basic level, most of your life-saving drugs involve interacting with the autonomic nervous system. At the paramedic level, that's very similar, especially for diseases that or emergencies that are associated with the cardiovascular system, types of shock, and so on. So although the autonomic nervous system is a nervous system section, it controls a large section of the human body, especially our vital organs. And since we give medications that manipulate our existing receptor sites, understanding how the body controls heart, blood vessels, ventilation, smooth muscle, and so on is extremely important for our ability to manage patients' emergencies in the field. So of the different topics that we have in pharmacology, the autonomic nervous system and the cardiovascular system will be two that will carry on to your other semesters and have an impact on how well you will do in the field. Now, I just want to be honest, this isn't to scare you away, but we have been tracking these courses over time, and it's very clear to us that students who do not perform well on the autonomic nervous system struggle when they get to other classes in the program. And some that don't pass the autonomic nervous system may not pass paramedic school, depending on other factors. So it's important that you take this section very seriously. All sections you should take seriously, except this one is going to cover a wide variety of things, not just the nervous system. So it takes more time. So as we get into this module, some things that I want you to consider. Number one, you should have already downloaded the documents from the state. That should include things like the New Mexico treatment guideline, New Mexico drug guidelines, operations, and procedure guidelines. You're going to be referencing those for basically all of your classes moving forward to paramedic school. Although you may have been prompted to download them last semester, we'll also be using them this semester and for the rest of our terms as well. So this is a tool that you're going to be using in addition to the study materials that are in your specific courses, like your textbooks. Now, I want to kind of talk a little bit about how you should approach studying for pharmacology. The Introduction to Pharmacology section has some introductory stuff, but not all of it would require you to review the drug guidelines. Here, though, moving forward, you want to consult the drug guidelines for the drugs and the topics that are within that section for our scope of practice. Now, when doing so, just some things that are helpful for your knowledge, the pharmacology class exams and quizzes generally don't ask questions about drug dosaging. You've got kind of a lot on your plate already. The dosaging, we don't ask questions about here, but you should be studying and begin memorizing the dosages when we cover the drugs in pharmacology, because when you're in lab, when you're in your other classes like trauma, we do expect that you'll have those drug dosages down. Those drug dosages will be on their exams, and in lab you're expected to know the drug dosages for any scenarios that you're running. So it's important that you know here we're not testing on drug dosages. You'll have calculations on every exam, as we've talked about for paramedic school, and here's no different, except when we provide you the questions that require a drug calculation for pharmacology, I'll provide you the dose that we want you to give, and then you'll have to figure out the drip rate, continuous infusion, and so on. So again, we'll provide those doses for you on the exams of pharmacology, but not on the other courses. So it is wise to start memorizing dosages while you're learning the drugs now to get a complete picture. As you go through, you're certainly now going to see that you're going to be learning about drugs that are in your scope of practice, but also about drugs in general that patients take. And so be able to differentiate between those two pockets of information, because certainly it's important for you to know if you can give a drug, if you can give that drug as inter-facility or just an administrative-based drug like you can push on a scene, or if it's something that's not in our scope of practice whatsoever. Now, the assignments in the autonomic nervous system are broken down into a couple different topics, including quiz and a few homework assignments. Now, for any class, this class included, make sure that you complete your homework assignments with enough time for you to be able to memorize them and study them before the exam. So if you're doing your homework assignments right before you submit them, the night before the exam is due, you're not going to have time to study them, and you'll probably suffer on the exam. The exams will all have questions based on the homework, and the homework is designed to give you an opportunity to practice some of the concepts that are, one, really important for our practice, but two, also included on the exam. The quiz that you're provided doesn't cover all of the topics that may be on the exam in this course. It's a combination of the content, your homework content, and your quizzes reflected on our exams. So please make sure that although you don't have to turn in your assignments until the due date, you should be working on them throughout the module well in advance of the exams, so you have time to memorize the things that you see are important in each homework assignment. So that's going to include things like, in this module, our ANS AMP review assignment. So that's going to be an opportunity for you to kind of work with memorizing some of the receptor sites and neurotransmitters that we actually did cover last semester in human systems, but as a foundational assessment tool for you to prepare for the drugs that use basically those receptor sites. You'll have another section on neuromuscular blockers. Neuromuscular blockers are in our scope of practice in one way, but then at the national level are kind of looked at in a different way. These are drugs that are used to help with RSI, or rapid sequence induction, for intubation of patients that otherwise could not be intubated because of their conscious and alert status, but also to facilitate paralysis when we're managing patients that have already been intubated without RSI, but maybe we're doing a great job with giving them oxygenation after they've been intubated, so their LOC comes up. Sometimes they have to be sedated or paralyzed so that we can keep that tube in place. So another important section. You'll also have an assignment on sympathomimetics, and sympathomimetics are one of the heart drug classes of the autonomic nervous system. So sympathomimetics are going to include drugs that are already in your basic and intermediate scope of practice, and a large number of drugs that are used in cardiology and other emergencies like shock treatment in the pre-hospital setting. You'll also have a ANS medication tree, which will help you organize the medications by the receptor sites that they work on, based on the A&P assignment that you did before this, if you're following the order of the class. Before you take the quiz, there's also an ANS math review. The math reviews in each modules are essential. You should be working on those and completing those things on your own, although you don't submit them. Well, why would you work on something if it's not required to submit? Because that's how you prep for the math that's going to be on each exam. So it's a good review specific to the types of drug calculations that you're going to see on each exam as we move through the pharmacology course. And then finally, you'll see the drug quiz. Okay, to wrap up though, let me give you some pointers on how I recommend you approach learning and what you need to get out of the ANS section. So it's extremely important that with our AMP assignment, you're working to memorize what each receptor does, what each receptor is responsible for if it's activated or dominant with all the organs that it interacts with. That'll be important primarily for the sympathetic nervous system, so looking at things like beta-1 receptors, beta-2 receptors, and alpha-1 and 2 receptor sites. Now for the parasympathetic nervous system, the receptor sites are also part of our homework and part of our exams, but we don't have a lot of drugs necessarily that work on those receptor sites. So our knowledge for the parasympathetic nervous system receptors is a little bit lighter than that of the sympathetic nervous system. Now, why do you want to know this? Well, when we're managing and presenting you with scenarios or seeing patients in the field, you need to be able to understand how drugs work so that you can use them to fine-tune your treatment to individual patient conditions. So for example, if a patient has a form of shock, not every form of shock should receive the same type of medication. Not every form of shock requires perhaps using something like a vasopressor, which you'll learn about in this module. So as paramedics from at least our program, we really want you to be able to meet the patient's individual needs by using the spread of drugs that you have in your toolbox. Now, understanding how a drug works is one part of the picture. So certainly memorizing that, for example, epinephrine works on specific receptor sites is part of the equation. But you need to understand what each receptor site does when stimulated, regardless of the drug. So start with memorizing the receptor sites, what the receptor sites do specifically in the organs, and your AMP review assignment is an excellent tool for that, gives you the great depth to do that in. And then later, when you learn about the drug, you'll then have the basic knowledge to say, if this is a drug that is an alpha-1 agonist, what does it do? Without having to memorize, when you memorize the drug, that it always does this thing. I'd rather you know its class and which receptor site it works on. Then you recall the information. That receptor site does X, Y, and Z. Here's an example. Norepinephrine is a common drug used in emergencies that involve certain types of shock in the pre-hospital setting. It's an excellent drug when utilized appropriately. Norepinephrine specifically is an alpha-1 adrenergic agonist. So that term means that it is a sympathetic nervous system drug working on the adrenergic nervous system, sympathetic. It's an agonist, so it stimulates the receptor site to do something, and alpha-1 is its receptor site. Now you should, when you get to that drug and memorize it, you should already have done the A&P assignment, and so then you'll know that the alpha-1 stimulation results in peripheral vasoconstriction. So when giving norepinephrine, you could certainly memorize, I wouldn't recommend it by itself, but you could and should memorize to some degree that norepinephrine will cause peripheral vasoconstriction. However, it's more important that you're able to say that norepinephrine works on alpha receptor sites, and alpha receptor sites cause peripheral vasoconstriction. So it's extremely helpful for you to think of it in that way. Other drugs like epinephrine, for example, work on other receptor sites. So then when we're presenting you with scenarios, including the exam on this module, you'll need to be able to determine which type of drug based on what its mechanism is on the body and which receptor sites it's working on to treat individual patient conditions. Now, there's a couple different ways to approach that. Certainly one is knowing the receptor sites and what they do, then knowing what the drugs do and how they impact the receptor sites, but then also looking at each slide in the PowerPoint presentations and the video at what we recommend those drugs are used for. So for example, norepinephrine is a great drug when we need to manage simply just causing blood vessels to constrict to help manage a patient's shock and blood pressure, but we maybe don't want to increase the patient's heart rate. There are cases in which if we cause the heart rate to increase as a means of bringing up cardiac output and bringing up blood pressure, we might cause the heart to exceed its workload and cause myocardial damage as a trade-off for the benefit of increasing cardiac output. So in some cases, you should be able to manage patient condition here in scenarios and in the fields by saying for this particular condition, with this type of thing, and you have a protocol for it, but that patient's condition in that protocol then dictates how you use the drug. So if you have a choice of different drugs in your protocol, you'll have to determine for individual patients how that works. So norepinephrine is a great device or a great drug when we're managing patients with something like neurogenic shock, where the blood vessels have lost communication, cause vasodilation, and so we use a drug to reverse the vasodilation, and that increases the patient's cardiac output and blood pressure. Now, in doing so, we didn't do much to the heart because norepinephrine primarily focuses on alpha-1 receptor sites. So this is a tough concept, and it's something that as paramedics at our level now, entry-level paramedics, we're asking you to learn some very high-level points of knowledge. But again, it's essential because we have these drugs in our scope of practice, and in the field, we're able to utilize these drugs to manage patient conditions. Gone are the days, if you've been around long enough to remember, that we used to only have really epinephrine and dopamine to manage patients for vasopressors. And so that would look like turning dopamine up until the blood pressure was adequate. We now have enough knowledge to know that that's not the right thing to do, and dopamine should not be used in every case where we need to manage a patient's blood pressures. So we're smarter now, we have more tools to use, and the expectation is that you are stepping up your game so that you can use those tools appropriately in your lab and in the field. So hopefully that makes sense to you. You need to understand the anatomy and physiology to the level that we're presenting you here, which is a review of what we talked about last term, the anatomy and physiology of the sympathetic and parasympathetic nervous system, the receptor sites and what they're responsible for when they're stimulated. Then on top of that, once you've got that down, you'll start memorizing drugs and their classification. And in the classification, it'll describe for you which receptor sites these drugs work on. It'll be using key terms like cholinergic or anticholinergic, meaning cholinergic is the parasympathetic nervous system because of acetylcholine as its primary neurotransmitter. Anticholinergic blocks the parasympathetic nervous system. And then adrenergic generally is going to be associated with adrenaline, which is another name for norepinephrine, or the layman's term for norepinephrine, and norepinephrine is the primary neurotransmitter for the sympathetic nervous system. And then you'll hear about non-selective beta agonist, non-selective adrenergic agonist, or selective like beta 1 or only alpha 1. And then there's the dopaminergic class as well for drugs like dopamine. All right, so if you have any questions, please reach out to me. I'll be dropping some more resources over this week. We have 2 weeks that we're spending on ANS before the exam. So I'll be dropping some more resources as I can make them for you. But I hope this will be helpful to you to kind of get a frame of reference when you tackle this, because it will be a step up from your memorization and studying that you used in the first module, Intro to Pharm. All right, schedule office hours with me if you need to. Send emails to answer any questions that you have, and I'll be happy to help you along the way. All right, good luck. Talk to you soon. Bye.